Okay, here's part 3 of musculoskeletal conditions, and we're going to look at osteogenesis imperfecta, or OI. Osteogenesis imperfecta is also known as brittle bone disease, primarily because it's characterized by fragile bones that break very, very easily. Other problems for people who have OI is some muscle weakness, hearing loss, because it does affect the little bones in their inner ear, fatigue, joint laxity, curved bones, which would result in scoliosis, brittle teeth, and even respiratory problems. If there's different types of osteogenesis imperfecta or different levels of it, and so some are very mild, and those mild cases would result in few fractures during a lifetime, where more of the severe cases, you would have hundreds of fractures during a lifetime. The incidence is considered to be 1 in 20,000 births. So osteogenesis imperfecta is actually a problem with type 1 collagen formation. So it is genetic, or it is a mutation on a gene that results in collagen or decreased collagen formation. Therefore, it's not because of poor nutrition or poor bone density or too little calcium. And so by taking calcium supplements, you're not going to cure OI. There's equal frequency among males and females, and among all racial and ethnic groups. Most cases are inherited from parents or being passed down from generation to generation. If a person has osteogenesis imperfecta, there is a 50% chance of passing it down to their children. However, there's some statistics out there that say approximately 25% of children who are born with osteogenesis imperfecta do not have a family history of it, and it's a result of a new mutation to that gene. Therefore, it's not anything that the parent did before or during pregnancy. Typically, they can make a diagnosis of osteogenesis imperfecta by completing an ultrasound exam sometime between 16 and 24 weeks. From that diagnosis, they may discover already fractures that have occurred in utero, primarily in the infant's arm, ribs, legs, those kinds of things. They can see kind of some of the abnormalities, because with osteogenesis imperfecta you may see curved bones, those kinds of things. So they may be able to pick up on it between that 16 to 24 weeks gestation. Type 2 osteogenesis imperfecta is usually apparent even less than 20 weeks, and so and we'll talk about the different types, but there's some types of osteogenesis imperfecta that are so severe, unfortunately, those babies that are in utero don't survive. They also can be diagnosed by a doctor's exam, and so if they do certain x-rays, they can actually detect certain types of fractures. And they can see the way the bones are broken in osteogenesis imperfecta is not like a typical fracture. They're more like a green stick fracture, where one side of the bone is curved and then the other side is starting to crack or fracture. And so a doctor's exam and x-ray may also help with that diagnosis. Genetic counseling is recommended for those who have osteogenesis imperfecta who want to have children. Certainly people with osteogenesis imperfecta are able to have children. It doesn't affect fertility typically. However, you think of how high risk the pregnancy would be, as if the fetus kicks the mother's ribs, they could easily break, it could easily rupture the amniotic sac. start premature birth. And then, of course, there's that 50% chance that the mother or the father would pass that gene onto the child, and that sort of thing. When diagnosed in utero, the majority of these pregnancies actually end in miscarriage or interruption. So because of the multiple fractures that even occur in utero, intracranial bleeding can cause death. Puncturing a lung can cause death if the rib is broken. And so just that quality of life is very difficult to predict. It may include having a child with OI, may include having multiple surgeries to try and correct the fractures or fix the fractures. And respiratory failure is the most frequent cause of death. Again, if you rupture or you break a rib, it could rupture your lungs. It could even pierce your cardiac or your heart muscle, which would end in death. And unfortunately, there's no cure. So the different types of osteogenesis imperfecta, type 1 is the most common and mildest type of osteogenesis imperfecta. So here you'll see mild bone fragility. They typically have relatively few fractures and minimal limb deformities. Type 1 accounts for 50% of the total osteogenesis imperfecta population. So they have lower than normal amount of type 1 collagen. However, the collagen that they do form is normal. And so the infant is able to typically survive birth as they lack fractures. Individuals with type 1 have normal height as well. Where some of the other types you will see a significant shorter stature. There's possible bluish discoloration of the sclera of the eyes, and they do have a high incidence of hearing loss as young adults, again because those bones in the inner ear are affected. Overall, they may have just general developmental delay, and so as an OT, you would be assessing those developmental delays, maybe in motor skills, self-care abilities. They may have muscle weakness, joint and ligament instability, so perhaps there could be some splinting, those kinds of things to give them more joint stability. Maybe some exercises as well to increase overall activity tolerance. And so again, your treatment plan may have high levels of exercise and physical activity, because you want to maximize their mobility and function, which would increase their bone mass and help develop that overall muscle strength. So again, with this type of osteogenesis imperfecta, exercise and physical activity are encouraged. However, because they still may have some bone fragility, I probably would not go out and recommend those high impact contact sports such as football and rugby and those kinds of things. Type 2 is actually the most severe form of osteogenesis imperfecta, and here the collagen that is formed is improperly formed, and so there's intrauterine fractures, commonly in the skull, the long bones like the femurs and the humerus, along the vertebrae, and so many of these babies are stillborn or die very soon after delivery because of respiratory and cardiac complications. Those that do survive for a very short-term period, there's respiratory and swallowing problems. The sclera of their eyes are very dark, maybe a blue-gray. They have significantly shorter limbs, small chests, soft skulls, and their legs are kind of in that frog-like position because of that hip dysplasia, those kinds of things. And so if somebody does have a child with type 2 osteogenesis imperfecta, They recommend genetic counseling if they, pursue to have additional children, those kinds of things. Type 3 is considered the most severe among children who survive the neonatal period. So, kind of confusing, but they categorize type 3 as the most severe among the children who survive that neonatal period. Type 3 also has severe bone deformities. With those bone deformities, you're going to have a very short stature. So if there's less space in your chest cavity, you may have less room for your lungs, less room for your heart, and so you may have those respiratory problems. You may have issues with swallowing problems that you'll see primarily in newborns. And their head is typically not relative to their body size. So their body size is very short in stature. Their head looks very typical. There's a video that I'm recommending you watch of an individual in a wheelchair, and she has, significant bone deformities that you can see in her movement. She's very short in stature, those sorts of things. So you'll see kind of these, how they present in an individual. The sclera may be white or tinted blue or purple or even a gray. And your care issues is to try and prevent fractures as much as possible. So with OT, our role may be to go in and assess their overall function and look at safety and prevention of fractures. To look at optimal respiratory function, which may be completed by a respiratory therapist, but OT should keep that in mind, maybe with nighttime positioning or positioning in wheelchairs, those kinds of things. Providing emotional support and strategies to cope with their short stature, with their fatigue, with just how do you cope with these severe deformities and looking very different. As OTs, again, we may look at trying to maximize their mobility and overall safety and function with their activities of daily living. I worked with a little guy who had type 3 osteogenesis imperfecta, or at least I think it was type 3. Yeah, I'm pretty sure it was type 3. He walked in, he was using a walker, some type of a walker to get around. He was very short in stature. He was actually in advanced classes and they bumped him up some grades, which isn't very common, but he just was so smart. And he started actually writing like children's stories when he was a child, like around 8 years old, on his condition. And so, very interesting young man. What was happening is I ended up going to his home. He lived in very rural North Dakota, on a farm. He was actually starting to lose some mobility because of fatigue. His family was really worried about him tripping over his walker around his home, those sorts of things. They had a very large ranch-style home. His walker was so wide, it was one of those walkers that goes behind the child, and he couldn't get into his bathroom with it. And so a lot of times he would park his walker outside of his bathroom and then try and furniture walk to his toilet. And it wasn't very safe. It was not very safe. And so I actually went into his home, did sort of a home evaluation, recognized that there were some pretty significant safety issues and tripping hazards. He couldn't engage in anything outside his home because there was scoria around his entire property. And so basically when he was home, he couldn't get anywhere. And because he was getting older, his family was having a hard time carrying him and picking him up, and they wanted him to be able to go outside and those sorts of things. And so what we did is I called a wheelchair seating system vendor, and I took this person out to the home with me, and I said, this person is at severe risk for tripping and falling, and fracturing his leg, his ankle, which had happened in the past. With toilet transfers, he was unable to engage in his environment outside. And so we wrote up justification, and the rep helped me identify a seating system that would help grow with this child. So there was adjustable seats, there was adjustable armrests, those sorts of things. And I mean, it was like the most, it was the coolest seating system I had ever seen and heard of, and I didn't even know these things existed. But basically, this little guy could push a button and the seat would raise up. It basically was on hydraulic, because he couldn't even get himself a glass of water at home. And so, again, maximizing function, helping him be independent with getting a glass of water, with getting into the refrigerator, with moving around his property outside. And so it had like the balloon tires on it, so that it wouldn't be punctured by the scoria, that sort of thing. And his insurance covered it because we had specific reasons. It was a very narrow wheelchair. It had pressure reducing things, cushions on it, those sorts of things. He could tilt back to relieve pressure. Again, it could raise up, it could raise down. So if he wanted to do a toilet transfer, he could push the hydraulic and the seat would go down so that he could do a safe transfer to the toilet. And it was narrow enough to fit in his doorway where this massive walker that he had didn't work. And so again, the seating system was used to maximize his mobility, and increase his overall safety and function while preventing those fractures. Type 4 is moderately severe, and here the fractures range in severity. The diagnosis can be made at birth, but typically it does occur later. And here there's moderate to severe growth inhibition or retardation. So again, you're going to have a very short stature. Adults are shorter than average. Their teeth may be very brittle. They may have light blue sclera as an infant, but they may fade to white over time. Again, your care issues, anything you can do to prevent fractures. They may have scoliosis. Again, you may be looking at coping strategies, emotional support. And again, OT's function would be very similar to type 3, and that's to maximize mobility, increase safety and function with independence, with activities of daily living, community participation, in-home mobility, those kinds of things. As we manage osteogenesis imperfecta, we may teach techniques for safe handling, maybe protective positioning, how to move safely. We may recommend avoiding certain activities such as contact sports. If somebody's in that shortened stature and they don't have a lot of room in their chest cavity, they may fatigue very easily. If their bones are shortened or elongated on one side and shortened on the other side, their muscles may not work as easily or as efficiently as somebody who is typical. And so they may fatigue very, very, very easily. And so our job as OTs may be to promote energy conservation, educate on energy conservation, maybe educating them on what activities to avoid, such as certain contact sports. However, maybe recommending that healthy lifestyle of, okay, swimming may be a good activity. Not smoking, maintaining healthy lifestyles so you maintain a healthy weight. Avoiding excessive alcohol, caffeine, and smoking because those types of substances actually deplete calcium in the bones, and that would make them more brittle, considering that they're going to have compromised bones already. So it would just be a healthy lifestyle is something we would want to promote. Again, with OT, just in general, I think everybody in the healthcare field would probably try and do their best to minimize fractures and maximize mobility, whether it's PT, OT. I consulted with a wheelchair representative, somebody who sells wheelchairs, because just what's on the market that can help this little guy, and I consulted with them, and they were more than happy to consult with me. Regaining or maintaining independence, just maintaining general healthy lifestyles. As OTs, PTs, we may look at different casts or splints. Again, if they have muscle imbalance due to bone deformities, we may look at wrist splints to give them more stability, or hand splints to give them more function. Casts, if we have training in serial casting, if they have a lot of broken bones, obviously they may be seeing an orthopedic surgeon. They may do casts, they may do wraps, certain bracings for their legs, ankles, knees, again, splints for their wrists. They may be working with an orthopedic surgeon. Sometimes if they have such bone deformities, they may place certain rods along the bones to give their bones more stability and more structure, and also to help facilitate their growth in a straight manner. They may be on medications to strengthen bones, and they may have certain mobility aids such as various walkers, canes, crutches, manual wheelchairs, electric wheelchairs, those kinds of things. Here's some of those green stick fractures, which you see commonly in osteogenesis imperfecta. So you can see kind of the bowing on one side, and then the other side is cracked. And so if you have somebody, again, here's some bowing, and there's a fracture here as well. So if you have a child who is coming into the ER a lot because of fractures, and it may raise some eyebrows. People may be suspecting child abuse. And so it is recommended that caregivers carry some sort of proof that they can get from their physician, or a physician statement on that this child has this diagnosis, so that they're not accused of child abuse. What's different with child abuse is you wouldn't have the bowing necessarily on your bones. They wouldn't be more of the green stick fractures. They would be more of the complete fractures, those sorts of things from blunt force trauma, or the spiral fractures from grabbing a child's arm and yanking them, or something like that. So again, there is some distinction, but it some people are called on social services when they have this diagnosis, because gosh, why is this child having so many fractures? Are they being beaten? Why can't they maintain this child's safety? And so again, having proof, they should have proof of the diagnosis. Here again, you see some significant bowing of the femurs, of the tibia, fibula, those kinds of things, and so their x-rays do look very different. Myths about osteogenesis imperfecta. Way back when, they used to say that all the babies that were born with osteogenesis imperfecta should not be moved, should not be allowed to move, and actually should be carried on a soft pillow, because you never knew when they were going to have a fracture. And now it's known that, with human interaction, being held, being touched, exploring one's environment, is in the child's best interest, because we know that being immobile actually increases bone loss, decreases muscle mass, which would lead to further weakness, which would increase frequent falls, which would increase further bone fragility. And so again, it's in the best interest of the child to be able to move around Of course, you'd want them to be careful in those sorts of things and do the best that you can with safety. Myth 2, people with osteogenesis imperfecta cannot have children when in fact it does not affect fertility. So again, they may become pregnant, but again, there may be complications due to skeletal problems of the mother. And again, high incidence, at least a 50% chance of the fetus also having some type of osteogenesis imperfecta. So here's a couple videos. Life with osteogenesis imperfecta. So just kind of a general informative video. The newscast, I think, is my favorite because it shows a young woman who is living with osteogenesis imperfecta, and she is making the most out of her life, and it kind of gives you a picture of what somebody with osteogenesis imperfecta could look like, as well as like her seating system and how an activity is probably modified for her to increase her participation. So it's one of my favorite videos. Thank you.